this is still beneficial to do. And it's sort of the same argument that we were having early on with remdesivir, where people were frustrated with it not being the end-all be-all treatment that resolved all your symptoms, but it helped people get out of the hospital. And that was a major priority at the time with cases spiking, certainly here in the Northeast in New York. It was excellent to see that this was keeping people off of ventilators, and that was a priority in the moment. But that also required that we had measures in place that also complemented it at the time. And when we talk about this, it kind of reminds me of the flu vaccine, right? Where we have this struggle for people to understand they are not immune to the flu. But if they get the flu, the severity is much more likely to be lessened. It's going to keep you out of the hospital, and that's a great thing. You'd rather be at home, bed, sick. And now we're talking about the same sort of circumstance for something that's even more transmissible, and that's deeply concerning. And understanding exactly what that conversation is going to be like, and for people to still apply social distancing measures that have not been followed Bible and verse in the last few months is troubling. You wish it was the cure. You wish it was the perfect vaccine, but if it's not, people need to understand it comes with parameters. And it's just difficult to see how discussions like schools reopening and public institutions and public gatherings and small businesses, especially in the winter seasons when people will be indoors, especially, it's hard to, I guess, gauge how it's going to affect that discussion.
Yeah, I think, one thing that for me, that I've observed that has really characterized this entire pandemic is the reduction of really complex things to false sort of dichotomies. So we know that most things in medicine and in science really exist on a continuum. They're not categorical or binary, but people seem to have been communicating this. And I think there's been so much misinformation that's really complicated this, that most of these really complex questions get reduced to, do masks work or don't they? Does remdesivir work or doesn't it? Does the vaccine protect you or doesn't it? And these questions are not necessarily binary. I think, they're all a matter of risk reduction. So there's not completely safe, completely dangerous. There's safer and less dangerous or more dangerous. This is a spectrum of risk. It's a spectrum of different public health outcomes that we're talking about. A mask may not be able to completely protect you, but it does offer some protection, and we know that it works well for source control at the very least. We reduce transmission, reduce the number of cases in total, maybe then we would have a chance of actually doing the test and trace type of containment work that would allow us to reopen safely until we do have an effective vaccine. None of that has been followed because I think in many cases, these issues have been oversimplified to the point where people think they have to make a yes or no choice, when really the answer is somewhere in the middle. And I think that it really is important, especially with vaccines, to understand that even partial protection, just like with the flu shot, is a public health benefit. If you can keep people out of the hospital, if you can keep them off ventilators, if you can save people's lives, that is a net benefit for our society, even if the vaccine doesn't work perfectly, or even if a drug doesn't work perfectly. And I think that there has just been an incredible challenge in communicating this to the public. And part of this is on us. It's on scientists. Scientists have not historically done a great job of communicating the nuances of these complex things to the public very well. There's tons of jargon. It's difficult for people to understand. You talk the way that you would to your coworkers as a virologist, and sometimes people from other disciplines, like a physician, might not completely understand me when I start talking about RNA-dependent RNA polymerases and so forth. And certainly there are things like I hear physicians talk about people's vital signs and measurements, and I have no idea what they're talking about. Like I know what pulse ox is, but a lot of these other things, there's a lot of really domain-specific jargon that gets used, and it makes it really difficult to communicate some of what we know and what we don't know, and what we think might be the case. And this is a hypothesis, and we need to test it. This is something we need evidence for. It's just really difficult to discuss those uncertainties with the public in a way that is actionable. And in my experience, both with this and with other, outbreaks. I've spoken with the media during the MERS coronavirus outbreak, during the 2014-2016 Ebola outbreak, because I study both MERS and Ebola, and now I also study SARS coronavirus too. But I've spoken with the public a lot about this, and it's very difficult to communicate like what we don't know. People want to know, is this going to kill us all? Is this going to become a pandemic? Is Ebola going to become a pandemic? Well, probably not. If it were, like, it might have already become a pandemic years ago, but we actually don't know. We never expected Ebola to spread as widely as it did in West Africa. People wanted to know, is it because the virus is inherently different? It took us, 2 years to figure out that no, it's not because the virus is inherently different. It works the same way pretty much. It's because of different patterns of behavior, different epidemiological aspects of the outbreak that allowed it to spread so widely in West Africa. Same thing with the Ebola outbreak that occurred in 2018 in the Eastern Democratic Republic of Congo. So there's a lot of things that are very difficult to talk to the public with. The public is interested in the science. They want to hear, though, about 20% science and probably 80% practical advice about how it's going to affect and impact their lives. The emails that I get now from just people who've looked me up and email me at my university email address, I get everything from my son has, X disease, chronic disease, and takes this medication. What is their COVID risk? Well, I have no idea, because first of all, I'm not a physician. But second of all, I don't think any physicians actually can tell them definitively what their individual patient, who they've never seen before's COVID risk is. There are just a lot of things that we don't know. Yeah. But that's the kind of stuff that people want to hear. They want to hear how this information relates to their lives and what they should do to protect themselves. And because there has been so much misinformation being spread around, so much speculation about what, oh my God, people don't have antibodies after 3 months. That means that we're going to keep getting this over and over and over again until we die. Well, probably not, but we can't explain right now how immune protection completely works. Yeah. So it's just very difficult to provide that kind of practical, applicable information to the general public with the data that we have now. And it's really hard to communicate that uncertainty and still say, we do know at least that you should wear a mask, and that you should avoid enclosed spaces, and that you should avoid crowds, and that you should wash your hands, and that you should practice physical distancing. It's just really hard to convince people of that kind of thing when all they hear otherwise from us is, I don't know, we're working on it.
And you don't have other answers. When you just hear that, it's terrifying. If you can't see the bottom of the ocean floor, then you're terrified of what could be down there. And if no one can fill you in, then they are no use to you. It's
absolutely,
it's very frustrating to see. And it seems like it's pretty symptomatic, to use an odd term here, symptomatic across other pandemics and epidemics of that we've talked with other experts about. We covered AIDS 2020 a few weeks ago, and I asked someone who had been working in the field at the time of them discovering HIV, like, how much of that then reminds you of now? And they're like, verbatim, beat by beat. It's 30 years apart, but it's the same stuff. It's the same discussions. It's the same issues. It's the same stigmas. It's just a different disease that we don't know, and we're being discredited because we're trying to figure it out, and we're being honest about that. So, I hope you and everyone else keeps fighting the good fight, and is just very upfront about this, because it's so important that, especially as so many people are just now having their first exposure to this level of science, they understand the limitations of research and the process of it. It's important that the data comes out from a journal before CNN reports on it or someone else. It's important that they understand there's a reason for the academics and your degrees and the discussion that's happening.
I hope so. Otherwise, I'll have to find a different line of work. But no, I agree. And I think that one thing that scientists have just been very bad about is really kind of siloing ourselves in these very domain-specific or ivory tower kind of environments in which we're not communicating as well with the public what it is we actually do. Because I think if you ask somebody, what does a virologist do? They picture somebody, probably a man, in a white coat who's probably pretty nerdy looking, with a pocket protector, maybe like looking in a, usually they have people with an Erlenmeyer flask, and we do use those sometimes, but you know, like doing lab stuff or looking in a microscope or whatever. We do all that stuff, but there's a lot more to it than that. And it's not just we look in a microscope and say, aha, SARS coronavirus 2. First of all, you can't see viruses under a light microscope, but you know, there's a lot more to it. And when you're dealing with something that's completely brand new, you know, we were just as lost at the beginning of this pandemic as everybody else, because while we knew it was a coronavirus, and it is good that there is a much more rapid flow of information now. For example, that's a great example, and it applies to vaccines actually. Both the Oxford vaccine and the Moderna vaccine were made because the Chinese researchers who observed that this was a novel virus uploaded the sequence to the internet basically on January 10th. And so that's how we knew early on that it was a coronavirus. And that's how people were able to start developing vaccines based on its genetic sequence. So that type of information sharing has been tremendously helpful. But that was all we knew about it on January 10th. We knew it was a SARS-like coronavirus, beta coronavirus. Like, we figured out what it was taxonomically. We knew it was related to SARS Classic, but we didn't really know much besides that. So we were able to start developing tests. We were able to start developing vaccines. We were able to start maybe applying some of the stuff that we knew about SARS Classic to it. But we've really been finding out the nitty gritty scientific details about how this virus works at the same time that the public is in many cases.
Yeah.
And while preprints, you know, are great for scientists, I think that they have, as you pointed out, confused the public discussion about this and public information about this, because people don't really understand. And why should you? I mean, it's kind of boring to think about, oh, the peer review process. So somebody writes a manuscript and then you submit it to a journal. And if you submit it to Nature, Science, or Cell, then they probably reject it without even sending it for review. And then you have to reformat it and send it to another journal. And then maybe they'll send it for review. And then you wait. And then your reviewers get nasty grams from the editor telling them to hurry up and review the paper. And then they send back their revisions and comments. And then you have to make those comments. And sometimes you have to do a bunch more experiments. And then it goes back to the reviewers. And then if they are happy with what you've done, if you're lucky, they'll approve the paper. And then like a month later, your manuscript will be published. Nobody cares about that process. And why should they? It's an awful process. So preprints have been excellent in the sense that they allow other scientists to not duplicate efforts of what other groups have already done. But people have, you know, taken advantage of it sometimes and put out really sensationalist, not very scientifically sound preprints. And the public and journalists who are not used to reading scientific papers especially, and there's a lot of them because a lot of journalists have sort of rejiggered their area of expertise from, you know, writing movie reviews to now they're covering COVID stuff. And it's very difficult for somebody who's not used to this entire process to sort of distinguish, oh, that's a good preprint and that one's not. And even the peer review process is certainly not infallible. I mean, there have been many high profile papers that have been retracted outright because, in fact, we have a couple great examples from this pandemic. There was an observational study of almost 100,000 patients who were given hydroxychloroquine to treat coronavirus. It showed that it had no effect. And you know what? All the work shows that that's probably correct. There's nothing really that convincingly demonstrates a major benefit from taking hydroxychloroquine, either as treatment or prophylaxis. But because this paper in the New England Journal of Medicine, a top tier medical journal, went through peer review, and it used a database that basically the work was not reproducible and they wouldn't show their primary data, that paper ended up being retracted. And that's a huge, huge high profile paper that contained potentially actionable public health information that, you know, underwent retraction. So it's very difficult, I think, for people to sort through this deluge of scientific information and try to figure out, oh, well, this is peer reviewed. Oh, this is in a great journal. Oh, this is a preprint. oh, this is a press release. I heard about it on the news. It must be true. It's really confusing for scientists, much less the general public. So I think that we really need to think about, after this pandemic is over, better ways to engage the public in these public health issues. Because one thing that I think has really affected this is that scientists, physicians, public health officials, in some cases have lost the trust of the public. And it's impossible to make good public health policy that people will engage with and follow if they don't trust the people making that policy.